I'm a non-invasive cardiologist here at Rush, and my areas of expertise are echocardiography, which is ultrasound of the heart, and also in prevention, both primary and secondary prevention for cardiovascular disease. Echocardiography is an innovation in cardiovascular imaging that I have a passion for. We can benefit the patient by being able to look at their heart from a two-dimensional and now a three-dimensional perspective. We can look at the chambers of the heart, we can look at the valves of the heart, we can see how well the heart is pumping or not. And from that information, be able to then develop implementations of care, whether it's different medications or procedure that may benefit them both in the short and long term. In conjunction with my clinical practice of prevention, both primary and secondary prevention, I'm also the medical director of our cardiac rehabilitation program. Cardiac rehabilitation helps patients who have had a cardiovascular event learn to modify their blood pressure, their diabetes, their cholesterol, but also lifestyle, how to get them exercising, how to help them lose weight, and how to help them both psychologically and emotionally return to being the person that they want to be, a part of their family that they want to be, and hopefully be able to return occupationally to their job. To be able to put together a plan of action and put together the pieces of a puzzle and get patients back to a place where they are comfortable, both from a cardiac perspective and a mental perspective, it gives me great pleasure.